Subclavian Steal Syndrome. Okay, by this diagram, it will be super clear. You will have stenosis of subclavian artery proximal to region of vertebral artery. Here you can see this is a vertebral artery. Two vertebral artery combine at the pontomedullary junction. They will form basilar artery. They will form basilar artery. And then basilar artery will supply the your hindbrain. They will supply to medulla oblongata, pons, cerebellum, midbrain, like that. Okay. So if you have stenosis here, okay, normally there is no issue. But when you do the arm exercise, you are doing exertion of arm, what will happen? Okay, you need more flow. But here is the stenosis. Now what will happen? Normally flow, both side flow is up like that. It is going up normally. But in this case, when the flow will decrease in this side, more flow is required, flow will be reversed. Now what will happen? A circle will form from here to here. There will decrease flow toward actually your main brain stem area. So you can develop vertigo, you can develop dizziness. So here important point is the vertebro-basilar insufficiency. Okay, and more than 50 mmHg difference in systolic blood pressure between arms. This is also important. So differential blood pressure is common in two diseases, aortic dissection and subclavian steal syndrome. Associated in very high yield, more common it is associated with arteriosclerosis, also in Takayasu arthritis. Other is the heart surgery. Most common heart surgery is the aortic correction repair. In aortic correction repair, you can develop subclavian steal syndrome. Most patients are asymptomatic. If patient develops symptom, do actually Doppler ultrasound of cardiovascular and upper extremity arterial circulation. Okay, that's it. We have done with that. Next is the angina.